May is Arthritis Awareness Month, which means I get to tell you about the condition that has me in a wheelchair for more than 15 years. What is arthritis? Well, according to medicalnewstoday.com, arthritis refers to more than 100 rheumatic diseases and conditions that affect joints. These conditions tend to involve pain, aching, stiffness, and swelling in and around one or more joints. The word arthritis means joint inflammation. However, inflammation may also affect the tendons and the ligaments surrounding the joint. The symptoms can develop gradually or suddenly and may impair a person's ability to perform everyday tasks. Some symptoms of arthritis include pain, swelling, stiffness, and the difficulty moving a joint. In addition to these general symptoms, certain types of arthritis may cause their own symptoms. For example, juvenile RA can cause eye problems, or septic arthritis often causes fever and intense joint pain. It can become an emergency if progresses to sepsis. There is inflammatory arthritis, degenerative or mechanical arthritis, cognitive tissue disease, infectious arthritis, metabolic arthritis, childhood arthritis, and septic arthritis, just to name a few. Some causes of arthritis include an injury, an abnormal metabolism, a genetic inheritance, an infection, and also an immune system dysfunction. Most types of arthritis are due to a combination of factors. However, some have no obvious cause and appear unpredicted. Some types, such as rheumatoid arthritis and lupus, are caused by an overactive immune system and affect multiple organs. But let's talk about rheumatoid arthritis, the arthritis that I was diagnosed with at the age of 6. According to the Arthritis Foundation, arthritis.org, rheumatoid arthritis causes joint inflammation and pain. It happens when the immune system doesn't work properly and attacks the lining of the joints, called the synovium. The disease commonly affects the hands, knees, or ankles, and usually the same joints on both sides of the body, such as both hands or both knees. But sometimes RA causes problems in other parts of the body as well, such as the eyes, hearts, and circulatory system and or the lungs. For some odd reasons, more women than men get RA, and it usually develops in middle age. Having a family member with RA increases the odds of developing RA. No, in a healthy person, the immune system fights invaders such as bacteria and viruses. With an autoimmune disease like RA, the immune system mistakes the body's cell for foreign invaders and releases inflammatory chemicals that attack those cells. Researchers aren't sure why people develop RA. They believe these individuals may have certain genes that are activated by a trigger in the environment, such as a virus or bacteria, physical or emotional stress, or some other external factor. Some symptoms of rheumatoid arthritis include joint pain, tenderness, swelling or stiffness that lasts for 6 weeks or longer, morning stiffness that lasts for 30 minutes or longer, more than one joint affected, small joints, wrists, certain joints in the hands and feet are typically affected first, the same joints on both sides of the body. Many people with rheumatoid arthritis get very tired, fatigue, and some may have a low grade fever. Rheumatoid arthritis symptoms may come and go. Having a lot of inflammation and other symptoms is called a flare. A flare can last for days or even months. No, to the scary part. Rheumatoid arthritis can affect eyes, which include dryness, pain, inflammation, redness, sensitivity to light, and trouble see properly. It can affect the mouth, dryness and gum inflammation, irritation, or infection. It can affect the skin, rheumatoid nodules, small lumps under the skin over bony areas. It can affect the lungs, inflammation and scarring that can lead to shortness of breath and lung disease. Blood vessels, inflammation of blood vessels that can lead to damage in the nerves, skins, and other organs. Blood, a lower than normal number of red blood cells. Heart, inflammation can damage the heart muscles and the surrounding areas. Painful joints also make it hard to exercise, leading to weight gain. Being overweight may make people with RA more likely to develop high cholesterol, diabetes, heart disease, and high blood pressure. RA can cause the ends of the bones within a joint to wear down, erosion. There are four stages to rheumatoid arthritis. Stage 1. In early stage, there's inflammation in the tissue around your joint or joints. You may have some joint pain and stiffness. If your provider orders X-ray, they won't see destructive changes in your bone. Stage 2. The inflammation has begun to damage the cartilage in your joints. You might notice stiffness and a decreased range of motion. Stage 3. The inflammation is so severe that it damages your bones. You'll have more pain, stiffness, and even less range of motion than in stage 2. You may start to see physical changes. And stage 4. In this stage, the inflammation stops, but your joint keeps getting worse. You'll have severe pain, swelling, stiffness, and loss of mobility. RA usually starts to develop between the ages of 30 and 60, but anyone can develop the condition. In children and young adults, usually between the ages of 16 and 40, it's called young onset rheumatoid arthritis. In people who develop symptoms after they turn 30, 60, it's called later onset rheumatoid arthritis. Complications of rheumatoid arthritis include damaged or deformed joints, viral infections, dry eyes and dry mouth, carpal tunnel, osteoporosis, heart disease, interstitial lung disease, and lymphoma. This year, we are using a green heart to celebrate the awareness of arthritis all across the world. So, if you or you know of someone with arthritis, you can use a green heart to show solidarity. Or do a creative idea today or anytime in the month of May to show your solidarity and support for persons who suffer from arthritis or any types of arthritis.